And to help us put some context to these numbers, we're going with Dr. Ross Goldberg, who's so great. He comes in every Friday and talks with us. Hi, Dr. Goldberg. Good to see you. President of the Arizona Medical Association and District Medical Group, Vice Chair of Surgery at Valleywise Health. All right, Dr. Goldberg, and let's start with that overreaching when we talk about numbers. So here we are, 1,500 new cases today in the last 24 hours. And that puts us back into the numbers we were getting back in July. So I have to ask you, looking at everything we're looking at, are 1,500 cases we're getting right now as concerning to you as the 1,500 cases we were getting in July in terms of how we're handling this illness?
Well, again, good morning. Always a pleasure to be on. Again, it's a trend, right? It's not a singular number. There's concern because things are on the rise again. And the only thing now is we learned from the last time. We knew what happened the last time. We could see that wave. And the hope is we can have a better response. We're preparing and we're hoping it doesn't get to where we were before. We want to make sure we prevent that spike, but the increase in numbers is a concerning sign.
But what else can we do now, Dr. Goldberg, in your opinion, besides what we're doing already? Now, I'm not everywhere at all times, but I go out a lot, you know, and I've been to restaurants and I go to stores to shop and things. And it looks to me at this point, and maybe you can back me up on this, I'm sure you go out and do things, that most people seem to be wearing masks, the vast majority, and the vast majority of people are social distancing. I mean, what more can we do at this point?
Well, there was the key thing you said was the majority, but not everyone. This isn't a majority do it, we're okay. We all need to participate in this. And look, it's tiring. I've said this a few times the last I've been on, that there's a fatigue that sets in from all of this, right? We're ready to have this over and done with. The virus doesn't care. So we have to be, really keeping a close eye on this, following the rules, wearing the mask, doing this physical distancing, but we all need to do it. It can't be some of us, it has to be all of us.
The governor, the state, but I think most decisions come pretty directly out of his office. That's just my feeling. I don't know for a fact, but I've been around that group. What they've done is they have basically, either what do you want to call it, lowered or raised the standards for schools. So basically saying it used to be if one of these benchmarks is not met, then the schools should close. Now they're saying all three of them if they're not met. Is that a good move as far as you're concerned, or is it a prudent move at this point?
Well, as we've seen throughout this whole pandemic, our requirements have changed over time. So you take in the data and you've looked at the trends, you see how people have responded, and you can tweak the guidelines. So what I would say is that it's okay to change the guidelines as long as we're being transparent about it and realize that we may have to push things forward or pull things back depending on how things move. So we're okay changing it as long as we're keeping a close eye and following the data.
Yeah, and I'm glad you said that, because that's one of the things that I think is hard for most lay people to understand, including myself here, is you hear a rise in cases and you think automatically alarm bells, hit the panic alarm. But what you're saying is when we're understanding more about this disease and who's being affected, we can have a rise in cases, but not necessarily be where we were in June and July, right? I mean, in terms of treatment and so many other factors.
Right. Again, it's not just the number of cases, it's the hospitalizations we're talking about. It's following the spread. So we can't just use one singular number. We have to look at the whole picture. And the different pieces putting it together will let us know where the trends are. Hospitalizations are going up on the outer counties. We have to be careful about that. It just, again, everyone has to keep on doing what they're doing. And if you get sick, to isolate yourself and then be in contact with your physician to hopefully not have you go to the hospital.
All right, Dr. Goldberg, it's always great talking with you. Hey, one last question again. You know, Corey is saying that every man should own a tuxedo, and I have a lot of respect for you, Dr. Goldberg. Do you, in fact, own a tuxedo?
I actually do, yes.
Because he's a man.
Because you're a man is what Corey just said. Dr. Goldberg.
I have to go to a couple events every year. It's just as easier to have the tuxedo available.
All right. Double-breasted, single-breasted, what is it? Do you have the patent leather shoes in your closet?
I do have the shoes. I don't always wear the shoes. It's single-breasted, and sometimes we go vest, sometimes not. You know, we like to have options.
Always great talking with you, Dr. Goldberg. Thank you so much. We'll see you next week.
Have a good one.
Stop laughing over there, Corey. All right, you're right.